item has been on transcendental meditation. Dr. Molina is a practitioner of transcendental meditation for over 25 years. So you should be able to get a lot of his questions regarding that answered today. The next talk will be a lot more focus on nutrition. We did the overview and we did nutrition as part of the overview, but we will go in depth and answer questions such as how many meals should you be eating during the day, how should you break up your meals, etc., and what are the specific things within your meals that you should be looking at. And then finally, the third part of the series is going to be on exercise and physical activity. Just getting to be physically active, not necessarily kind of jumping on the treadmill every day, has shown to have a lot of benefit. So Dr. Molina again will cover exercise and physical activity in the third one. We hope that we can come back, like 6 weeks to 8 weeks apart, and then this will be available for you on the YouTube video as well. So let's just play the video now.
Just do it full screen.
It was here at El Camino Hospital that we first started noticing South Asians being admitted into the emergency room for heart attacks at an unprecedented rate and younger than anyone expected.
Our friends, our neighbors, our family members are struggling with heart disease, struggling because they do not know the risks, the dangers, and the realities that we face.
The reality is that India is in the midst of an epidemic of coronary artery disease. While only accounting for 17% of the world population, they account for 60% of the incidence of coronary artery disease in the world. This epidemic does not discriminate between gender, social status, or educational status. It's an epidemic that affects all.
South Asians don't know, they aren't aware of how serious their risk is. And this has to change.
Up to 50% of heart attacks occur in individuals below the age of 50, and up to 25% of heart attacks we're seeing in individuals below the age of 40.
Initially, when people come into the South Asian Heart Center, they tend to be very surprised. They follow a vegetarian diet, are slim, tend to be young, may not smoke or drink, but they still run the risk of having heart disease. Following a vegetarian diet is not necessarily a cure-all, especially when it's grain-based and not green-based.
There are studies that show that within 4 months of lifestyle management, you can begin to reverse coronary artery disease.
Our mission is bold. The South Asian Heart Center at El Camino Hospital will reduce this high incidence of heart disease in South Asians by raising public awareness, evaluating risk factors with advanced screening, and supporting lifestyle changes with heart health coaching. The South Asian Heart Center has put together an incredibly effective program to address this epidemic. It consists of you as a participant, your primary care physician for medical management, and the center as your lifestyle coach. Our AIM methodology starts with a full assessment, including an advanced lab test. We identify your level of risk and the intensity of the lifestyle changes to help manage that risk. The South Asian Heart Center at El Camino Hospital is the first non-profit response to this global epidemic. We are breaking new ground by getting out in front of this disease.
I would especially appeal to the women in the South Asian community because, as usual, they are the leaders in every change that is necessary to improve the quality of human life.
We prepare the meals, buy the groceries, take the kids out to their activities. We are the foundation for teaching our entire family how to make better choices.
I would also like to appeal to physicians in general to be alert to the higher risk that this population of South Asians has for coronary artery disease.
South Asians have unique clinical characteristics that may not be addressed by the typical management of cardiovascular disease. Our participant's physician is a key partner in the mission of the South Asian Heart Center. The South Asian Heart Center does not practice medical care. We are an asset to the practicing physician.
Without your help, this will not be an easy task.
Well, I'm here personally because I would like to know how healthy my heart is. You know, I have a personal history in my family of heart disease.
We cannot hope to reduce the incidence of heart disease in our community unless you get screened, understand your risks, and make the changes that will add healthy years to your lives.
I really don't know what I expect to find. You may feel healthy. I don't feel unhealthy, but at the same time, I know that that doesn't necessarily mean that there aren't issues that I need to deal with.
Come to us, go to your physician, but take action now. We cannot do this without you.
We're going to make a difference and find a creative solution for this epidemic.
It's been an easy process so far, and I look forward to coming back in a couple of weeks to really hear the evaluation of where I am. I think that's really going to be the most important part for me, to really know where I stand.
So Dr. Molina is actually here. He's just transferring his file over in presentation, so it will just take a few minutes. Do you have any questions on our program that I can talk about? Yes.
So in the assess part of the team, you were talking about comprehensive testing. Is that something similar to an annual physical that you would go through, or is that more like based on a referral from?
So actually, the comprehensive testing includes what the primary care physician may do, like the lipid panel, etc. But there are advanced tests that we do beyond that, which help us better understand what your risk factors might be. Some of these factors are emerging genetic factors, and that helps put your entire risk profile in perspective, and we can kind of aggressively work on certain things because we now know, where your issues are. The other part that it really helps with is what sort of nutrition program might help you. So that can get tailored as well. So we have a nutritionist on board who's a South Asian nutritionist. If you have a predominantly South Asian diet plan at home, then you need help with that, and our nutritionist will be able to help out. You also get a consultation with an exercise physiologist, so you can kind of go over what your current program might be, how you can augment it, how you can add other things to it. And then you also get a consultation with our meditation expert who's part of the Transcendental Meditation Organization. So you can go through with them how that process runs, and if you would like to kind of join them. So the laboratory test, which is the only thing that you get charged for, is covered by insurance, for most insurances. If you're on specific plans, there is a better tie-in, so they are directly covered. But for most insurances, the cost is not more than $83 out of pocket for you. And typically, this test runs about $700, $800.
So the other things that
Yeah, there's no charge to those. All the consultations. So here is Dr. Molina. Dr. Molina is the medical director of the South Asian Heart Center. He's also a co-founder. He has been very instrumental in putting together the entire clinical part of this program, and we are very happy that he he can come out here and give a talk on TLC, which is really lifestyle changes.
Hello, good afternoon. Thank you for coming, and I apologize again for my delay. I'm glad I'm not an airline pilot. I would actually have to be on disability because I have a time management disorder. I'm very fortunate to be a physician, so my clients are known as patients, so which is sort of a very important quality. So today we're actually going to talk about the physiology of stress and stress reduction. And this is actually going to be a talk about, and in this talk we're going to be going over the data behind the statement that stress is associated or related to coronary artery disease and decreased longevity. This is actually, even though it's sort of taken for granted, it makes sense that stress is associated with reduced longevity and increased cardiovascular disease. Actually, there has had to be a process in which we have shown this to be the case. Is that working?
Yeah.
So we actually are going to initially define stress physiologically and psychologically. What do we mean by stress? We're going to explain the effect of stress on the physiology and its impact on human biochemistry. We're going to describe the influence of stress on cardiovascular risk factors and risk reduction. And we are going to describe a unique hypo-metabolic state of restful alertness and its medical implications. So we're going to do at the end is I'm going to give you an example on how you can apply a stress reduction technique and see what happens to the physiology and what the medical implications of that is. So next slide, please. So this is actually the brain when we are born. You know, we all are taught that we are born with a certain number of neurons in our central nervous system. We're also instructed that you are born with a set number of neurons and that those neurons are not changeable. They can only go down, they cannot go up. But the fact is that there is data to suggest that there can be neurogenesis in the mammalian central nervous system. But what happens from birth on is that we make a large number of connections. So we may have more or less a fixed number of neurons, but the number of connections within our central nervous system are, in many ways, you can think of them as unlimited or infinite. So this is the brain of a newborn, and this is actually the number of connections. That's the number of connections at 3 months, and with the next slide is the number of connections within 6 months. So the same amount of neurons, but you can see as the child matures, as there is there's a learning process, emotional learning, rational learning, sensory learning, there is a very, very large number of connections. Unfortunately, those connections, as the child continues to evolve, to grow and mature, many of those connections get lost if they are not used. So we can make connections and we can actually eliminate connections. Go ahead. So there's more to the brain development than just making connections, and that is the brain of a newborn is lacking, and it's lacking on some chief in speed. So the nerve axon is actually a slow conduction, but then we develop this myelin around the axon, and this myelin actually enhances the speed of our neurologic connections. And let me give you an example. If you throw a ball to a 2-year-old, the child will see the ball coming, but you will notice that the ball will hit the child before the child can grab the ball. Because what's happening at that moment is that even though you can immediately see the ball, the motor action of grabbing onto the ball is very slow because there is slow nerve conduction. That same child at the age of 15 can catch a ball from a pitcher at 90 miles per hour. So there is actually something that happens, and what's happening is that the axon is actually turning faster. In conditions such as multiple sclerosis, where people become completely disabled, what happens is their neurons are unchanged. It's the myelin, that conduction velocity, that is actually eliminated and destroyed. Go ahead, next slide, please. So let's talk a little bit about brain anatomy. And the thing that I would like you to pay attention to is to the frontal part. At one time, humans were actually competing with animals in the jungle, and it was between us and the tiger. What happened is, as we evolved, we did not become faster than the tiger who was chasing us. Actually, we have not been able to outrun the tiger. But what happened is that with development of our frontal cortex, we have been able to outsmart the tiger. So human development, rather than in speed, to sort of leave a threatening situation, we actually have developed intelligence, and that is actually located mainly in the frontal cortex. So the mammalian, if you look at the mammalian brain, the brainstem, the inner brain of what we call the lizard brain, their functions there are very similar. They're sort of autonomic functioning. But what separates a human from a horse, for example, is the fact that we do have a very, very large frontal cortex. That frontal cortex is also known as the chief executive officer of the brain. This is actually where you make your decisions. This is actually involved in learning. It's actually a very, very important part of your existence, and probably that's why, because of your frontal cortex, that's why you're sitting here. Next slide, please. So these are the functions of the executive area in the brain. The frontal cortex, it has to do with judgment, planning, decision-making, moral reasoning, working memory, and self. Now, let me give you an example of a human that does not have the frontal cortex online with the rest of the brain. And we have all experienced that in our own lives. And that is, a teenager has a frontal cortex, but the connections between the frontal cortex and the rest of the brain are not there. Meaning, that area is the last part, next slide, that gets myelinated. This myelination begins at the age of 12. In conditions such as ADD and ADHD, what is thought is that those connections actually are not very well made. So that frontal cortex then gets stimulated by non-specific drugs, such as amphetamines, to try to make connections with enhance the connections with the rest of the brain. Next slide, please. So let's talk a little bit about stress, the stress response. So this is actually how the brain is sort of, the location in the brain is very important with the function of the brain. In the back, we have the visual area, and we then have the sensory area, the motor area, and we have the frontal cortex. With stress, next slide, please. What happened is that we actually start working out of the brainstem. Very, very important. This is where autonomic function is. Keep going. Next. And we then fixate on surface details of experience, stereotypical response like, let me get out of here and run, and we become highly emotional. That is actually the individual in which the frontal cortex is turned off, and then the rest of the brain takes off, and that is responsible for sort of running away from the tiger. Now, the individual who has a well-developed frontal cortex and connections to the rest of the brain can actually modulate this stereotypical response and then think his way out of it, outsmart it, and be successful. This is a typical warrior leader, the guy or the gal who can actually think under stress and figure out a way to defeat the enemy. Next slide. So let's just then define stress. What do we mean by stress? So we actually have two definitions of stress. We have a physiologic definition and a psychological definition of stress. And the physiologic definition states that stress results from the inability of the physiology to maintain balance, a steady state, and or homeostasis. So we know that in biological systems, homeostasis is really important. Everything tries to stay in a balanced state. That is also true in chemical reactions. We know steady state reactions. We also know about entropy in the laws of thermodynamics. So in human physiology and in physics and chemistry and on biology in general, there is always this push for homeostasis, the steadiness of being. This is what we call physiologic stress, the inability to maintain that balanced, steady state. So what is actually psychological stress? Well, psychological stress results from the inability of the individual or organization, that is, results from the lack of creativity of the individual organization to address a challenge. So the moment that you take a test and you know the answer to your question, it's not stressful. If you don't know the answer, but you have the creativity and the knowledge to figure it out, it becomes a pleasure, not a stress. You don't know how to figure it out, then it is actually stressful. So what it means by this is it's really not necessarily the outside stimuli, but it's actually how you come up with the answer. Are you creative enough to deal with change, to deal with a challenge? If you do, it's not stressful. If you don't, then psychological stresses accumulate. The same thing with about physiology. If you are able to maintain a steady state, you don't get a blood clot in a coronary artery. All the systems are there so that you don't form a blood clot in a coronary artery. If your system is not in a balanced state, then you can form a blood clot in a coronary artery, and there you go, you have a heart attack, or in the brain, a stroke. Next slide, please. So let's look at imaging, and this is actually an imaging of a normal heart. This is actually PET scanning looking at glucose metabolism. You can look up on the frontal cortex, the CEO, and the rest of the brain. And this is actually an image of someone who is actually, next slide please, on drugs and alcohol. Anatomically, the brain looks the same, but when you look at function, you see all these holes. And this is actually from the Amen Clinic. He's done a lot of imaging looking at function with glucose imaging and PET scanning. And this is sort of an individual who is a heavy alcohol and drug user. You can see that in many ways, he appears to be lobotomized functionally. The frontal cortex is not working. This is also very common in criminals, in individuals who actually lack empathy. And with the absence of empathy, what is happening also is that that frontal cortex there is not well developed, is not biologically active, functional, and then the lack of empathy then in many cases leads to crime. Next slide, please. I'll get to you in a moment. So let's sort of summarize here. So the prefrontal cortex is involved in planning, judgment, moral reasoning, working memory, decision making, and the self. And this issue, this sort of knowledge, this concept of stress arises and actually was first coined by a Canadian physiologist by the name of Hans Selye. And he actually said that, next slide please, that stress is that which obstructs the flow of intelligence. Therefore, stress is that which turns off the frontal cortex and those processes involved with creativity and intelligence and understanding. And that is actually the outcome of the final outcome of what stress does. Next slide, please. So let's look a little bit about physiology. When we are confronted with a challenge, let's imagine that we're driving off amphitheater into shoreline. Someone sort of runs a stop sign, and we are in the process of avoiding an accident. Well, the normal response is this, the red one. You arise to the challenge, you avert the danger, and you get back on with your normal functioning and driving. That should be the normal response. It has to be a response, and then you have to go back. There's a recovery phase. Someone with an abnormal response, they tend to continue to relive that physiologic flight-fright response for a long time before they achieve recovery. Looking at someone who is abnormal too is the person who is unable to rise to the challenge. So the first two probably were able to address the challenge, survive, and avoid the accident. The one that in the bottom was not able to rise to the challenge and was involved in an accident. This is sort of the typical 90-year-old person you see in an emergency room at 2 o'clock in the morning with pneumonia, in a coma, who is unable to muster a fever. His response or her response to the challenge is no longer there. There has been a loss of response, and then there you go. And pneumonia is said to be sort of the friend of the elderly. Next slide, please. So let's talk a little bit about what is sort of happening to the brain during the stress response. During stress, we actually produce a large number of hormones, particularly a hormone known as corticotropin-releasing factor, or CRP. That is actually produced by the hypothalamus. It goes down to the hypophysis, the pituitary gland, that produces ACTH. ACTH comes to the adrenal gland, and the adrenal gland produces cortisol. Cortisol goes up to the brain and has a negative feedback, but cortisol also has an effect on the hippocampus. The hippocampus is a very important structure in our brain that is associated with memory. And if you ask someone who has spent a month in the intensive care unit, they will not remember what happened to them during that month in the intensive care unit. There is actually very little consolidation of memory, and it is actually the effect of that stress response. At the same time, you produce cytokines here to the right, and the bottom line is that you actually decrease the production of brain-derived neurotropic factor. BDNF is one of the neurogenic growth factors. And the fact is, even though we believe that most of the neurons that we're born with are fixed, we actually do have some neurogenesis, and BDNF is associated with the support of present neurons or nerve cells. It's also involved in the support and creation of new connections or synapses, and also may be associated with the production or creation of new brain cells from stem cells. Well, what happens is that that stress response leads to the suppression of the production of BDNF. Decreased BDNF leads to atrophy of the hippocampus. This actually can be seen easily in experimental studies with rats and mice. But when you look at humans, obviously we cannot do that experiment on humans, even though unfortunately there are historical experiments of torture and stuff like that. But in a human with depression, with severe chronic depression, in humans, you can actually see atrophy of your hippocampus and loss of memory. So let me then summarize. With atrophy of the hippocampal function, that leads to destruction of neurons, decreased short-term memory, decreased contextual memory, and poor regulation of endocrine response to stress. And that sort of explains the 90-year-old individual who shows up in the emergency room with a severe life-threatening pneumonia, unable to muster a fever, to chills, to elevate the white blood cell count and fight the infection. Next slide, please. Now, we have a structure in front of our heart, and that's called the thymus gland. The thymus gland, the name of thymus starts with T. And I'm sure you all have heard about T lymphocytes and B lymphocytes. Well, we actually produce our lymphocytes, which are our immune cells in our bone marrow, in our long bones, and also in our vertebral bodies. Those cells are immature. They move to the spleen to become B cells, and they produce antibodies. So when you get a vaccine and you produce an antibody response, this is the result of the B lymphocytes. But when you are exposed to a virus, when you're exposed to a bacteria, there are some cells that go in to manage the reaction, and those are called the T lymphocytes, are called T killer lymphocytes. You have heard about that because in AIDS, the T killer lymphocytes are destroyed, and the person then gets an immune deficiency. So the thymus, which sits in front of the heart, is a highly innervated organ. There are great, super duper trunks of nerves going in there. And the fact is that for reason, we don't understand the process, but our brain is involved in the education of our T lymphocytes through this nervous connection from the brain to the thymus gland. And what we see, and I'll show you the data in a moment, is that with chronic stress, you actually have an effect on your immune system. And I'll show you the data with responses to vaccine and responses to viral infections. Now, this is a presentation provided by the South Asian Heart Center that pays attention to the increased risk of cardiovascular disease among South Asians. But the study that I'm going to show you in this slide is about 30,000 people And this is a multi-country, that is 52 countries participated in this study. And it's called the Interheart Trial, and it's a study that was done out of Canada. And what they did is they identified 9 risk factors associated with premature coronary artery disease and heart attack. So the first one is the ratio of bad cholesterol to good cholesterol, that's ApoB to ApoA, diabetes, and hypertension. The other ones are smoking, abdominal obesity, psychosocial stress, the consumption of vegetables, fruits, and fruits daily, exercise, and alcohol intake. You can see here that psychosocial stress is sort of highlighted because we're going to be talking about that. Next slide, please. And this is what psychosocial stress is defined for the purpose of this study. Stress was defined as feeling irritable, filled with anxiety, or as having sleeping difficulties as a result of conditions at work or at home. After adjusting for age, gender, geographic region, lipids, that's cholesterol, high blood pressure, and smoking, chronic stress was associated with a 2.7-fold increased risk of heart attack. And in fact, in this trial, it accounted for about 28% of the incidence of a heart attack. Next slide, please. Now, this is a very busy slide, and we probably will have to skip it because we don't have 2 hours to talk about it. But actually, these are multiple studies, and the references are there, and they are on our website, in which you can actually look at the data connecting stress with cardiovascular disease. The third one down, this adrenergic cardiomyopathy, is also very common. It's actually very common in Japan. It's called Takotsubo's cardiomyopathy. It's also known as broken heart syndrome, where individuals would show up in the emergency room with an evidence and suggestion of acute myocardial infarction. And what happens is that the heart looks like a trap for a squid or octopus. That's why it's called Takotsubo's. And you do an angiogram, and they don't have a heart attack, but they just behave just like a heart attack. If you treat them conservatively, they tend to sort of improve. You have a question back there? Yes. Well, actually, vegetables and fruits are very important in the prevention of cardiovascular disease and stroke. And the consumption of 5 servings a day of vegetables and fruits versus less than 3 servings or no servings of vegetables and fruit per day is associated with a 24 to 27% decrease in the risk of stroke and heart attack. Today's talk is not about nutrition, but it's part of our curriculum. But the fact is that the consumption of fruits and vegetables per day, being physically active, not smoking, and not being obese is associated with a 40% drop in the incidence of a heart attack or enhancement of longevity within 4 years of assuming those 4 healthy habits. So there is actually very important data to suggest that the way you live is actually associated with enhanced longevity and successful aging. Go ahead. Sure. So the question is, what is the story about fruits and vegetables and cardiovascular disease? And you just sort of heard the answer. One last thing here about stress-induced obesity. Actually, stress is associated with obesity, and there's actually a peptide has been identified, neuropeptide Y is involved in stress-induced obesity. Is also associated with metabolic syndrome. Next slide, please. Now, this is actually an interesting slide, and these are emotional triggers for heart attack. And I will sort of give you 3 examples over here. And this is, remember the first Gulf War, where Saddam Hussein invaded Kuwait, and we just sort of kicked him out of there. And he was sort of crazy enough to start sending some missiles to Jerusalem and to Tel Aviv. So during that time where he was sort of trying to bomb Tel Aviv, there was actually a 58% increased risk of sudden death and acute heart attacks in Tel Aviv. I remember the Prime Minister showing up on TV with a gas mask and all that kind of stuff. And it appears that also enhanced the anxiety of the citizens. Now, how about sporting events? When matches in Europe are settled with soccer penalty shots, the relative risk of dying from a heart attack or stroke in men goes up 51%. So, not a good idea to sit in front of the TV at that time, particularly if you're a guy. How about earthquakes? Well, this is actually a very nice natural experiment. We had 2 earthquakes to compare. the Northridge earthquake in LA in 1994 and the Loma Prieta earthquake here in Northern California, I think it was in 1989. So one heart attack, actually those two earthquakes had occurred at different times during the day and the week, and they were associated with different outcomes. The incidence of heart attack went up from 149 the week before the earthquake to 201 the week after the earthquake in LA. Cardiac sudden death went up from about 5 per day to 24 the day of the earthquake. Next slide, please. However, the Northridge earthquake in LA occurred on a Monday morning, while the one here in the Loma Prieta earthquake occurred, I think it was on a Thursday afternoon around 5:30, showing that Monday morning in the winter is among the most lethal time for an event such as this to take place. And it's actually not uncommon. Monday morning is the day of the week, the time of the week where you see the highest number of heart attacks showing up in the emergency room. Next. Now, how about the immune response? We talked about the T lymphocytes and looking about immune response. So this is actually a chart, a graph showing the immune response to an influenza vaccine. These are individuals who are caregivers of patients with Alzheimer's, and taking care of someone with Alzheimer's is very stressful. The hash bars are individuals that are the control, and you can see that the response to the influenza vaccine by two different techniques was no better than 50%. And that is thought to be mediated by the stress of caring with someone who has someone with dementia. How about the common cold? These are actually two slides. In the dark line here, the complete line versus the hash line, you can see the total number of symptom scores on the left and the amount of mucus produced as measured by measuring the weight of Kleenex tissue. So that's how you do the experiment. You can see that the individuals who had high psychosocial stress produced more secretions than the individuals who had low psychosocial stress, and their symptom score was much higher than those who were not under psychosocial stress. Next slide, please. So let's just summarize a little bit about stress. And the fact is that it's this issue about lack of control, lack of self-sufficiency and autonomy. It's this issue of the clock in the back, trying to, you are actually then a prisoner of the time crunch and the demands for which you actually, in many cases, do not have control. Next slide, please. So let's look about stress and job strain. And what happens is here is defined as high psychosocial demand, but also very importantly, low degree of control in the work situation. Next slide, please. So that in itself is associated with a 2 to 3-fold increased risk for coronary heart disease over a 14-year study. Next slide, please. You have a question back now? Next slide. Now, how about bad relationships? How about hostility and controlling behavior? So this was done in a study of 154 couples, and they were actually seen, they actually were monitored by an observer, and they actually were asked to have a conversation about something that is stressful to them to discuss, an item of conflict between the partners. And after long-term marriages, I'm sure that most couples can identify that. And what was noted was that after they did the interview, they scanned the people, the subjects, and they were able to look, they were looking for coronary calcification, which is a measurement of coronary arteriosclerosis. And what was identified was that for women, hostility increased the risk of heart disease. For men, dominant or controlling behavior increased that risk. The interesting thing is that the women were unaffected by their own or their husband's dominant behavior. So in a relationship, if you have a conflict and the man has sort of expressing dominant or controlling behavior, affects his heart health, but has no effect on his spouse. However, if the female spouse, a woman, has hostile behavior rather than domineering behavior has a very negative effect on her heart health, but no negative effect in her husband's heart health. Next slide. This is another slide looking at coronary calcification between couples, individuals who have gone through the stress of a divorce versus individuals who have not gone through the stress of a divorce. The individuals in the dark gray lines versus the white lines do show that there is increased risk of coronary arteriosclerosis, just separated by the by divorce incidents. Next slide, please. So, can stress age us? That's that's sort of the next question before we talked about what to do about stress. Well, this study was actually published in the PNAS, the Proceedings of the National Academy of Science. This picture is from the Washington Post, and what it shows is the chromosomes, and the chromosomes at the end have little telomeres, and these telomeres are involved in the replication and repair of that chromosome. As we age, the telomere length shrinks, and there's an enzyme involved in that process called telomerase that repairs the telomeres. So they did the experiment in mothers of children who were chronically ill, because that's thought to be a very stressful situation to be caring for someone with cystic fibrosis, leukemia, a child with a chronic illness. And what they found was that the mothers who were most stressed had the shortest telomeres. Next slide. Suggesting that actually stress ages us. Stress can affect our genetic material, shorten our telomeres, and age us. Now, there was subsequently a study published in Lancet Oncology, and this is actually looking at lifestyle and telomerase activity, and a study in which included diet, exercise, and meditation, stress reduction, showed that versus controls, there was an increase in the activity of telomerase, maintaining then the telomere length. So that's the bad news. The bad news is stress is bad for you. It ages you. It ages you, affects your genetic material, shortens your life expectancy, increases your risk of diabetes, decreases your immune response, your capacity to respond to an infection. And if you lack the creativity, also the capacity to sort of know what is sort of going, the capacity to know. Now, how about what can we offer then? What can we offer to counteract stress? So we at the South Asian Heart Center research the literature, and our mandate is to provide a culturally appropriate process of stress, of heart disease and heart attack reduction. And we look at the literature. In 1971, there was a paper published in the American Journal of Physiology by investigators at UC and at Harvard. And what was shown, that these individuals showed that there was a hypo-metabolic state of restful alertness in 36 subjects who served as their control. And they used a simple technique. They had heard about monks in the Himalayas sitting down and controlling their respiration rate, their heart rate. But it was very difficult to go up to a mountain and do a study. So what they did is they looked at subjects who had learned transcendental meditation. And this is actually a picture from Scientific American published a year after of one of the subjects in the experiment. What they found is that during the practice of TM, there was decreased oxygen consumption, decreased carbon dioxide elimination, decreased respiratory rate, and decreased minute ventilation. Next slide. And this is a slide of the subjects doing the practice of TM. In the black, you see that there's a drop in oxygen consumption, and in the red, you see that there's a drop in carbon dioxide elimination. So there was no change in the respiratory quotient. What was happening is that during the practice of TM, there was a drop of about 16 to 18% in metabolic rate, oxygen consumption during the 20-minute periods of meditation. Next slide. Let me sort of show that again to you in a respiratory fashion. Here to the right, in the right panel, those little lines going up and down is respirations, in and out, in and out. So the subjects were advised that whenever they experienced sort of this called transcendental consciousness, to hit a little marker. So what is this so-called transcendental consciousness? So let me tell you how the technique works. In this technique, the subjects are taught a word. That word is called a mantra, which in this case means a meaningless sound, no meaning to it. So using the pleasure of the mind, the pleasure-seeking principle of the mind, the conscious mind uses this sound that slowly goes away until the sound disappears. So you're conscious of the sound, and then the sound goes away. There's no longer sound, but you are still conscious. And therefore, we call that sort of pure consciousness. During that episode, this is what happens. You can see up on top, on the top line, there's a little marker here. You can see these little markers here. You can see that the subjects were breathing, then they stopped breathing, then they hit the marker, stating, I have just been in this sort of, I have lost my mantra, now I have regained my mantra, and they sort of hit the marker. So during this period of the practice of this meditation technique, there's actually cessation of breathing that goes along with this loss of sound and just experience of just pure consciousness or pureness of being. Now, how does this look when you image the brain? So up in the top, you see the frontal cortex, and you see metabolic activity here. Down below, you see the thalamus. So everything that comes up to your cortex, every sensory experience has to come up through your thalamus. In red, in this slide, shows metabolic activity, this glucose uptake. The brain is a glucose obligate metabolizer. So this is with the eyes closed. When there is practice of meditation, what you can see is that there is actually increased activity in the frontal cortex. If you compare this slide versus this slide, there's increased activity in metabolic activity in the parietal lobe. Compare this one with this one. And the thalamus is actually, there's decreased activity in the thalamus. So as you are actually experiencing a word, a meaningless word, a more refined values, and then with disappearance of sensory experience and just you're purely conscious. So there's consciousness, the process of knowing, and the object. With the loss of the object, that is associated with decreased activity in the thalamus, through which all sensory stimulation comes in, and increased activity in the frontal cortex. So how does that look with the EEG? So this is actually a study that was done in San Francisco. There are about 2,000 students who have learned this technique at this Unified School District in San Francisco. So they actually did some EEG studies. And this is just part of the, the class. It's taught on their class, and they have a subject sitting behind a screen. And the students have to guess what is the subject doing. So this is actually the EEG from the frontal cortex and the occipital cortex, the two separate hemispheres. As you know, they're separate. And this is the EEG of someone with eyes open. This is the EEG of someone with eyes closed. So with eyes closed in the occipital part, which is the two middle lines there, you see increased synchronization. But the frontal cortex are not synchronized. With the practice of meditation, this is what happens. You get synchronization of the two top line, the top line and the lower line, which is the frontal cortex, with the occipital lobes. So it appears during the practice of this technique, what you see is increased frontal cortex metabolic activity, decreased thalamic activity, and increased EEG coherence between the posterior part of the brain, the frontal part of the brain, and the two separate hemispheres. So then the question is, so what? What does, why is this important? So we go back to the example of the tiger and outsmarting the tiger. During stress, you usually have, in the typical individual, has the disengagement of the executive function and the engagement of the flight response function. During the practice of this form of restful alertness of meditation, what happens is that the flight response is disengaged and the frontal cortex, the executive cortex, is then engaged. And as you then train the brain to keep those connections, as you then respond to other stressful stimuli, you are able to maintain the frontal thinking part of the brain engaged with the rest of the brain. And that should actually make you a better individual who has enhanced capacity to think during stress and to come up, be creative enough to come up with the answer. So what are the medical implications? And because we're short of time, I'm just going to give you a little summary and then show you some data. Medical implications of practicing this technique twice a day is to reduce insomnia, anxiety, and tobacco and alcohol consumption in patients with PTSD in VA hospitals. There's data showing decreased systolic and diastolic blood pressure, decreased angina in people with an increased exercise capacity in people with coronary artery disease. Done a study at the VA hospital in LA. Decreased insulin resistance, particularly in pre-diabetics, a study done at Cedar-Sinai, published in the last few years. Reduced cholesterol and triglycerides, a study done in Israel. Increased HDL cholesterol, decreased carotid arteriosclerosis, and a 43% reduction in death and mild stroke in people with coronary artery disease, and I'll show you the data. Next slide. But before that, remember we talked about the importance of maintaining a metabolic response, a neurologic response to stress, and the importance of being able to modulate that. So here actually is a study looking at faster habituation to a stressful stimuli. In the blue, the meditators, in the red, the controls. So they are actually presented with a very noxious sound, which is very stressful to the individual. The meditators in the blue tend to actually become habituated faster. That is, it takes them less time to stop being bothered by that noxious stimuli. That is actually as compared to the control subjects, where they do not experience that same habituation. And when you're looking at it, at stressful stimulation and returning back to baseline and recovery, in the blue, you see that the meditators tend to have a smoother curve versus after multiple, you see multiple responses for hours to go in those who were the control subjects. This is a study done here in Oakland, looking at senior citizens with hypertension, showing that the practice of meditation is associated with a lowering of the systolic blood pressure. You see that within 3 months, and is extends over the 8 years of the study as compared to a different relaxation technique called progressive muscular relaxation. This is a study showing you again that there's decreased angina, and there is actually increased duration, decreased workload capacity on a stress test in people with coronary artery disease after 3 months of the practice of this technique that we have incorporated at the South Asian Heart Center. This is a slide showing that there's decreased carotid arteriosclerosis by showing decreased carotid intimal thickening in the meditators versus the control subjects. And this is a slide showing that there's decreased cholesterol in the practitioners of meditation. This is actually control for diet. Now, in the South Asian Heart Center, and one of the metabolic factors associated with increased risk of heart disease among South Asians, and it appears that there is a problem of reverse cholesterol transport. There's a problem with HDL cholesterol. HDL cholesterol is the good cholesterol. It's the highly desirable cholesterol. It's the cholesterol associated with decreased coronary artery disease. And it tends to be very high in people who make it to the age of 100. So HDL is associated with enhanced longevity, and it's associated with decreased risk for coronary artery disease. There are very few things that increase HDL cholesterol. Exercise will increase HDL cholesterol. A low carbohydrate diet will slightly increase HDL cholesterol. Will mainly work on triglycerides, not that much HDL cholesterol. Drugs can actually increase HDL cholesterol. The only one that we know is actually niacin, a vitamin. But it takes up to 2 years for exercise to show an increase in HDL cholesterol. And in this study, even though it looks small, because you're talking about only 4 to 5 milligram elevation in HDL cholesterol, per every 1 milligram elevation in your HDL cholesterol, your risk of heart disease goes down 2 to 4%. So if you have about an 8 milligram elevation in your HDL cholesterol, then your risk of having a heart attack goes down by 32%. And this is actually very easy, because if you don't like to exercise and if you don't like to eat a healthy diet, you're sitting in a chair. That individual likes to sit in a chair. Well, sitting in a chair with the eyes closed can actually help you with your HDL cholesterol. How about diabetes and insulin resistance? They looked at individuals, the normals, versus individuals who actually were pre-diabetic on the farther graph. You can see that with health education, there was actually no change in insulin resistance. In the green, with the practice of meditation, this was published from the Cedar Sinai, there was actually decreased insulin resistance after 3 to 6 months of the practice of meditation. Both groups were getting health education. This is actually, I'm just showing you this slide to show you hospitalizations for heart disease. And this is a study done with 5,000 participants of Blue Shield. And this, in the red, the controls versus the meditators. There was an 87% drop in the need for hospitalization for heart disease. Now, lastly, this thing about biological age. And you can actually affect your biological age with your lifestyle by about 12 years. You can age by 12 years depending on how you live. You can actually enhance your biological age by 12 years on how you live. And I show you the data from the Lancet Oncology showing that with a program of diet, exercise, and meditation, you can activate telomerase, the enzyme involved in the protection of the telomeres, which is sort of like the age marker for your chromosomes. And in this slide, I show you a figure looking at controls, short-term meditators and long-term meditators, and the average biological age versus chronologic age of long-term meditators was 12 years younger. So what does this mean? Well, in medicine, there are some very few experiments that are so striking, because it's easy to find out if you're alive or you're dead, and there's no fudge factor there. This is actually a slide that shows you from a study that was done in Oakland, the survival from the cardiovascular mortality and all-cause mortality between the meditators and the control groups. And there was about a 28 to 38% drop in cardiac mortality and all-cause mortality in the subjects who were practicing meditation versus those who were not. This is a more recent study. This is actually from the University of Wisconsin in Madison, looking at about 204 individuals with heart disease. These are people with high-risk heart disease. In the green, you see the individuals who were on full medical therapy, were practicing meditation. In the red line, hash line, you saw individuals who were full medical therapy and who were not practicing meditation. And you can see that within 5 years, there is actually a significant 47% drop in the incidence of heart attack, stroke, or death in those who were practicing meditation versus those who were on full therapy, medical therapy, but were not practitioners of meditation. And this is a study from Harvard looking at residents in nursing homes, and they had 4 groups. They actually, this is a little difficult slide to see, but they had in the blue the practitioners of meditation. They had a progressive muscular relaxation. They have active thinking in the cream color chart and the control groups. What happened is in the practitioners of meditation, these are individuals who were 73 years of age and entry of the study. They were followed for 3 to 6 years, already residents of sort of convalescent homes or homes for the aged. You can see that the pressure of the meditators was lower versus the other controls. They have increased cognitive capacity and flexibility, but more importantly, there was absolutely no mortality in the group of practitioners of meditation, such that if you need to get into a study, make sure that you fall into the TM group. Yeah.
We are at time. Maybe we
So we actually we are ready to sort of complete the talk, and if you have any questions, I'll sort of be happy to answer them. Go ahead. Yes. Actually, the question is, on that scan, scan that I show you, in the presence, there was a comparison between a normal brain and the brain of an alcohol-consuming, drug-addicted individual. And the question is, was that under the influence of drugs and alcohol? And the answer is yes. But what the question is, was this individual acutely intoxicated? And the answer is, I don't know. But he was an active user of drugs and alcohol when he was imaged. It is actually, the question is, are these lack of connections reversible? And I don't have any data, so now I'm guessing. And my clinical experience is that it's reversible. Now, how reversible, I can't tell you, because this process of connecting the frontal cortex with the rest of the brain is a process that happens and is both an age-dependent and experience-dependent. It's an experiential. It happens as a result of experiences. The human brain is very changeable. It's very malleable. So if a child at birth has a nurturing environment and has a stimulating environment, the number of connections of that child in the brain will be many more connections than someone who is deprived. That has been seen when you look at sort of some crazy experiments that were done during and before World War II, where individuals were institutionalized and children were institutionalized in the attempt to create a great race or whatever. And the fact is that there was lack of development, and emotional development and intellectual development as a result of being institutionalized. That's a problem when you're trying to get people out of poverty, and poverty means it's more than just not having money, where there is actually decreased brain development. Can you make it up? We have great examples of people who have made it up and gone farther. They actually have overcome all those disabilities, but on average, it's very difficult to overcome. Go ahead.
Two questions. One is, you talked about with all the data of the benefits of meditation. Are other forms of meditation also equally or almost beneficial? That's the first question. Second is, how do other breathing exercises like pranayama and these sort of things help on the cardiovascular?
Excellent. So the question is this data that was shown here today just isolated to the practice of transcendental meditation? Can other techniques provide the same kind of effect? And then the second question is, what is the effect of pranayama or breathing exercises on the physiology? So to answer the first question, all the data that was shown here refers to transcendental meditation. The question then becomes why? Well, because that's where the data has been collected. So there's not much data in peer-reviewed journals looking at these questions with the practice of meditation. Now, there is data looking at conditions like psoriasis, data looking at anxiety by itself, but looking at cardiovascular health, looking at diabetes, there is not much data that can be sort of consistently demonstrated to you to be able to sort of show you what the physiology of their response is. And what happens is this. Tigers, lions, and your household cats all are felines. They all are members of the cat family. But your household domesticated cat is still a cat, but it's different from the lion up in the jungle. So we cannot say, well, because they're both cats, that they're going to behave similarly, because we know by experience that a lion is different from a household cat or a tiger.